Welcome to Boombostic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change. Each week, we bring you candid conversations with top experts, innovators, and leaders, exploring the latest trends and technologies shaping the future of healthcare. Join us and be part of the conversation in transforming healthcare.
Okay, good afternoon from Vive in Los Angeles. We are in the Diagnostics zone, recording the Boombostic Health podcast, and I'm very happy to have here Eric Strafel, the CEO of Molecular Testing Labs, MTL.
Yeah, it's good to be here day two. Good to sit down and take a break from all the interesting things going on. So
thank you for joining us. So I'm familiar with your lab, with the executive team that you've built. But what's very fascinating is that you actually come from a different industry.
Yep.
And you're now CEO of one of the leading molecular labs in the industry. Your previous career came from aerospace, defense. Tell us more about that and how your mindset has an impact now in healthcare at large.
Yeah. I'm a mechanical engineer by training, 25 years in aerospace and defense, mostly big companies, but some startups. And so I think that gave me a level of systems thinking, structured thinking in a highly regulated industry as well. So that kind of carries over into healthcare, also highly regulated, in understanding systems thinking from all the components fitting together to deliver good quality care has been helpful. So I've been in the industry about 4 years now.
Okay.
Very new for me. I would have found it hard to believe that it could be harder than aerospace, but some of the challenges I think are harder just because all the players involved is such a huge part of the industry.
Okay.
But it's maybe one of the most rewarding things you can do is do something innovative and important in healthcare.
Yeah. So it seems to me like someone like you that is coming into the industry brings maybe discipline that is different, innovation that is different, ways of working, workflows. Tell us more about what you think you brought in that didn't exist before and how you're leveraging that to grow the lab.
Yeah, I think there's a balance between structure and repeatable processes and innovation, and the two have to balance, right? So we're from a startup back in 15 years ago, very innovative company, and we've got our startup roots, but we also need to do repeatable tests and deliver consistent results day after day after day. Right. And so putting those two together while maintaining innovation, while driving consistency is the challenge that a lot of startups go through. And so coming from a bigger company and seeing the systems thinking, seeing what robust processes and what I call management operating system look like is really important. And a good example is we started program management and program management best practices, onboarding new programs a few years ago when I got on board. And some of the resources that we brought in to start that were from aerospace.
Okay.
And it was an outsourced PMO company with a bunch of aerospace and defense project managers, program managers, certified PMPs that have to, working with really big budgets, working on really complex projects in a highly regulated environment and bringing that skill set into doing new innovative things in healthcare and doing it well, reliably, on time, which is what we need to do. So kind of marrying those two structures together and leveraging some best practices, maybe from A&D into healthcare has been helpful.
Interesting, very good. And the impact is there. You run millions of samples a year. I believe you're known for STI testing and HIV testing. Can you tell us more about the impact and what you guys are doing there?
Yeah, I mean, the problem to solve for us was what is keeping people from getting a diagnostic test.
Okay.
And so whatever those barriers to care were, which is stigma, geography, cost, we wanted to solve those one at a time. And in early days, 2011, 2012, STI testing was one of the biggest stigmas to people going and getting tested. And so that was one of the areas that we launched in, proved that if we can make it easier, more convenient for people to get tests, make it more affordable, then you can get more people to take care of their health and give them the ability and empower people to take care of their health. And so that led into an expanded test menu, into all the chronic condition management and gaps in care program and hormones testing and everything that we support today in support of digital health and providers and payer organizations. And so trying to break through the friction point of getting a diagnostic test, taking that learning across our test menu to then create options to supplement testing where it's not happening today has been where we built the business.
Very good. And so the whole Gaps in Care initiative, tell us more about that for those that don't know exactly what Gaps in Care is.
Yeah, it's essentially with health plans that are working with a population of people and trying to manage good health across that population. When they identify a high risk patient set that need to get a test for kidney function or kidney health or A1C or diabetes, we want to get those people tested so they can get the appropriate treatment. And sometimes to get people tested, you have to make it really easy to do that, which is us building a kit, sending it to their house, building an engagement model around that so they return a test and you get a result, and then inform the payer so that they can then manage their member group to manage good quality care and keep costs down, which helps everybody.
Yeah. So yesterday, I believe in lunch, we were talking about the industry, what happened during the pandemic, people being conditioned that it's easy to be tested at home, to swab at home, to send back a sample. What do you kind of like, what is your forecast on the continuation of home testing innovation for labs like yours, for the industry at whole, and for the improvement of care?
Yeah, I think as consumers are becoming more and more informed of their own healthcare, right? You see everything, all the AI companies here and ChatGPT Health and in every version of that, right? So consumers are more informed than ever. The therapeutics available and the drugs available are more than ever. And as consumers are getting more informed, they're still engaging with a traditional healthcare system that starts with going to the hospital or going to your primary care provider. And so I think as we build that bridge between consumer-centered care and traditional care, that's what COVID kind of forced people to do. Take care of yourself, empower people in your home, consume what we would call consumer-facing healthcare, right? Or consumerized healthcare. And so I think post-COVID and now finding the new normalization, there is still an engagement layer of those two things coming together, and it's growing over time. Consumers getting more informed, wanting to take more control of their health, focused on things like longevity is one of the big buzzwords these days, right? How do I just maintain my health longer, and how do we make that more accessible to more people is where our mission comes in. And then tying that back into the traditional care so we can bring innovation integrated with the traditional healthcare system where your primary care provider is still the front door health, right? Still the locus of care. And we don't want to change that. We just want to add the elements that bridge somebody taking care of their own health with a provider or a healthcare organization that is also trying to do the same thing and try to create a seamless journey across the two that will lead to things like more diagnostic testing in the home.
Yeah, excellent, great. So we're here, obviously at Vive, there's a lot of talk about AI. So what do you think about AI? How does it play a role? If it's in the lab, if it's on automation of the lab, if it's admin, if it's interpretation, how do you see AI play a role? What are the risks? What are the potential advancements and opportunities?
Yeah, I think AI for us, like everybody else, it starts with just workflow automation and finding ways that we can just run the lab more efficiently. I think there's elements around patient engagement to help just find ways to engage patients with their diagnostic results, as an example. That will play into it more and more. We do run our own software for our lab, and so coding, our software dev team uses AI to code these days, like a lot of people. And so it's showing up in day-to-day work for our team for sure. I do think it's going to change work across the board, but I also think there's a severe lack of capacity in the healthcare system overall. And so I think we need to be very intentional with AI to create capacity across the board. And if we do that, I think we can start to lead to better outcomes. And so what it looks like today is what seemingly is a bunch of point solutions, and some things winning and some things still being piloted. Over time, I think we're going to see that, and over time, I mean like a couple years. I think it's going to be a near-term window. We're going to see what emerges in terms of creating real value in integrated care models that can be scaled.
Right. Yeah. Like yesterday, right after the opening remarks by the president of Vive, we had the chief innovation officer from Philips talking about how do we integrate diagnostics. It must be integrated. Lab is one piece of the diagnostics. Obviously, there's radiology and other divisions of diagnostics that all have to come together and make sense. And be available for the clinicians and for all the caregivers.
in wearables, like you have we both wear Oura rings, right? So I get a lot of insights. I'm used to my app, right? I check my sleep score every day.
Right.
And there are diagnostics that would be a good part of that journey, right? Because ultimately you need a diagnostic to take additional action, right?
Yeah.
And so I think you'll see wearables integrated with diagnostics that are then more easily integrated to a traditional provider network.
Yeah. Yeah. So zooming out of your lab, thinking about healthcare, thinking about the role of diagnostics in healthcare, we've been talking a lot about diagnostics potentially being like the operating system or the infrastructure that drives healthcare and healthcare decisions. What's your vision for the future of diagnostics? Where do you think we're going? What are the opportunities or the risks?
Yeah, I think diagnostics is the data engine that powers healthcare, if I could, look at it that way. And so it's everything from drug development all the way through managing chronic conditions and trying to empower people with care. We've got to figure out how to integrate that journey so that people can, right now we all have diagnostic test results, that from our last primary care visit, and none of that's connected.
Right.
And so we've got to find ways to connect that over time. We've got to find ways to build on those data sets, find the trends that are meaningful for us. And then you tie that to genomic data. And then I think that leads into personalized care.
Yeah.
And so all that whole ecosystem of data, I think, is going to come together into more personalized care over time. And one of the key data sources empowering that is diagnostics.
Yeah. Yesterday I was on a panel talking about healthy aging, and what I said there is that healthy aging starts at day one, right? A lot of people think that they start taking care of their health aging as they age and as they're maybe 40, 50, 60. Never too late. Yeah. But really at day one, there's an opportunity to engage the parents, the mother, the child with diagnostic testing, with information, with data that really kind of like sets the whole trajectory forward on how you're going to manage care for that individual.
Yeah.
And diagnostics is powering that.
Yeah.
So kind of like closing, what are you most excited about that you're seeing here at Vive and beyond for the next years to come? And what are you really like as a leader in the diagnostic space, in the laboratory world? What are you and your kind of like leadership colleagues, planning and thinking about?
Yeah, I think I'm most excited about all the people trying to innovate for good, right? There's a lot of change and innovation happening in the industry. Conferences like this are bringing different partners and collaborators together to try to figure that out. It's a big problem to solve. It's not going to happen overnight, but the desire is there to innovate. And there's a lot of investors that are also focused on that as well. So I'm really excited about where this can go over time. From a leadership team perspective, we've got to be a company that can move fast. And so we want to be agile as a company. That means setting clear direction, being really clear on the problem we're trying to solve. Every time we launch a new test, we have a new product development process now that's gated, so we can assess how that's performing, if we're meeting the intended clinical result, how we're going to launch that into the market, how do we put the right clinical data around that to support our channel partners that we launch through. In that step-by-step process and moving fast with rigor is going to be really important, and we've just got to be agile. And so agile to us is the leadership team, how we run the business, still promoting innovation, but also the ability to scale and deliver consistent results over time, which is our management operating system, which we spend a lot of time doing. So we've got an innovation team, and then we've got a run the business team. And when the two come together, we're bringing new innovation to market faster.
Yeah. Well, I know you guys, and I know the lab, and I know you put together a really great team with great team structure, people from the industry that know what they're doing. So it looks like you have a bright future. Thank you for sponsoring in the Diagnostic Zone. Thank you for being on the Boombostic podcast. And I'm sure we're going to continue the conversation because you guys are an important piece of the ecosystem.
Yeah, absolutely. Thanks for the time. It was great to catch up.
Thank you.